Papillary thyroid carcinoma, or PTC, is the most common type of thyroid cancer. The thyroid gland is a small, butterfly-shaped gland located at the bottom part of our neck. This gland is important because it makes hormones that control our metabolism, heart rate, body temperature, and many other things. When we say carcinoma, it means there are cells in the thyroid that are growing abnormally and have become cancerous. The good news is, among all types of thyroid cancer, PTC has the best prognosis or chance of recovery, especially if it's found and treated early. The word papillary refers to how the cancer cells look under a microscope. They look like tiny fingers or papillae. PTC usually grows and spreads slowly. Often, it starts as a lump or nodule in the neck. Many people don't notice this lump right away because it doesn't hurt. Sometimes it's only discovered during a checkup for another reason, like a neck ultrasound. Early detection is very important so it can be treated more easily and prevent it from spreading to other parts of the body, like the lymph nodes in the neck. Often the first symptom of PTC is a lump in the neck that you can feel. This lump might move when you swallow. In some cases, you might have a hoarse voice that doesn't go away, difficulty swallowing, pain in the neck or throat, and swollen lymph nodes in the neck. But remember, not all lumps in the neck are cancer. Most thyroid nodules are benign or not cancerous. So it's important to see a doctor to properly check what's causing the lump and get the right advice. Let's not be scared right away. The exact cause of PTC is still not fully clear, but there are things that can increase the risk. One of them is exposure to high levels of radiation, especially when you were young. For example, if you had radiation therapy to the head or neck before, having a history of goiter or other thyroid diseases, and if you have a family member who had thyroid cancer, can also be a risk factor. Understanding these possible causes can help us be more aware of our health and see a doctor right away if we feel something unusual. If a lump or nodule is found in your thyroid, your doctor might recommend a biopsy. The most common method is fine needle aspiration, or FNA biopsy, where a thin needle is used to take a small sample of cells from the lump. This sample will be examined in the laboratory. To guide doctors, they use the Bethesda system for reporting thyroid cytopathology. This is a classification system with 6 categories. It helps the doctor know how likely it is that the nodule is cancer and what the next step should be. The Bethesda system is not a type of disease, but a tool for diagnosis. Category Y means the sample obtained was not enough and the biopsy needs to be repeated. Category 2 is benign, meaning it's not cancer. Categories 3 and IV have some doubt, so closer monitoring or another test might be needed. Category 5 is suspicious for malignancy, which has a high chance of cancer. And Category 6 is malignant, which is confirmed cancer. This system is very important because it provides clear direction for the correct treatment. If the biopsy result confirms papillary thyroid carcinoma, the main treatment is surgery called thyroidectomy. Depending on the size and location of the cancer, only half of the thyroid gland might be removed, called a lobectomy, or the entire gland, called a total thyroidectomy. The goal of the surgery is to remove all cancer cells. In many cases, especially if the cancer is small and hasn't spread yet, surgery alone is enough to treat it. The choice of which type of surgery to do will be discussed by the patient and their surgeon. After surgery, the doctor might recommend radioactive iodine or RAI therapy. This is done to destroy any remaining thyroid cells in the body, including cancer cells that might not have been removed during surgery or have spread to other parts. Thyroid cells, even cancerous ones, naturally absorb iodine. In RAI therapy, you will take a capsule or liquid with radioactive iodine. This will be absorbed by the remaining thyroid cells and destroy them from within. This therapy helps reduce the risk of the cancer coming back. Many people ask, is papillary thyroid carcinoma deadly? The answer is yes, it's possible, especially if it's not caught early or is neglected. Although PTC has a high survival rate, it doesn't mean it should be ignored. If left untreated, the cancer can continue to grow. It can spread to nearby structures in the neck, like the lymph nodes, muscles, and even the trachea or windpipe. When this happens, it can cause symptoms like difficulty breathing and swallowing, making it more complicated and harder to treat. When PTC has spread to distant parts of the body, like the lungs or bones, it's called metastatic cancer. At this stage, treatment becomes more difficult and the prognosis is not as good. This is why early detection and treatment are so important. Let's not think that just because it grows slowly, we can postpone it. A small and easily treatable problem can grow and become a serious threat to life if left alone. So the moment you notice a lump, consult a doctor right away. After a total thyroidectomy where the entire thyroid gland has been removed, the body can no longer produce thyroid hormones. These hormones are very important for almost all processes in our body. Without thyroid hormone replacement, a person will experience hypothyroidism. Its symptoms include extreme fatigue, weight gain, feeling cold, dry skin, constipation, and depression. This is a serious condition that, if left untreated, can lead to complications like heart disease and even coma. Because of this, patients who undergo total thyroidectomy need to take thyroid hormone replacement medication, like levothyroxine, every day for life. This medication serves as a replacement for the natural hormone that the thyroid used to produce. It ensures that metabolism and other body functions remain normal. Besides this, taking levothyroxine at the correct dose also helps prevent the cancer from returning. It prevents the pituitary gland from producing thyroid-stimulating hormone, or TSH, which can encourage remaining cancer cells to grow again. Many people think that papillary thyroid carcinoma is only a disease of middle-aged people. It's true that PTC is most commonly diagnosed in people aged 30 to 50, but it's important to know that thyroid cancer can happen at any age. There are cases in children, teenagers, and even young adults in their 20s. It doesn't pick an age, so being vigilant is necessary for everyone, regardless of your age. The risk doesn't just disappear after age 50. In fact, while PTC is often found in younger people, cases diagnosed in older patients, like those aged 60 and above, can be more aggressive. In older people, there's a higher chance that the cancer is already larger or has spread to other parts of the body by the time it's discovered. So, age at the time of diagnosis is one of the important factors doctors look at to determine the prognosis. Being older doesn't mean you're safer from this disease. The prognosis or outlook for someone with PTC depends on many things. This includes the patient's age, the size of the tumor, whether it has spread to the lymph nodes or other parts of the body, and the patient's overall health. Generally, the survival rate for PTC is very high, especially for localized cancer that hasn't spread yet. But every case is unique. Your doctor can give you the most accurate information about your specific situation. The most important advice I can give is this. If you have any symptoms like a lump in your neck, hoarseness, or difficulty swallowing, please don't hesitate to consult a doctor right away. Don't be afraid and don't ignore it. Early diagnosis is key to successful treatment. Remember, your health is your most valuable treasure. Being proactive in self-care is the most effective way to fight any illness, including papillary thyroid carcinoma. Let's get checked.